We couldn't talk about senior care without having a little commercial from AARP.
Hey!
Hey!
Hi!
It's time to crack an egg.
Easy, any style egg works here.
Or smile.
Well done, this looks great.
Time to share a story.
I have a great way to start our discussion.
With old friends or new ones.
When you're a caregiver.
Time to breathe in.
Inhale up, good job.
Then let it all out. It's never been easier to connect, learn, and have fun.
Cheers!
So let's do it together. Come find us at aarp.org/near-you.
Welcome to Delta Days in the Bronx. It's Friday, June 4th, and today we're going to hear from Assemblywoman Karines Reyes, who will share information about senior care and services here in the Bronx community. Thank you for joining us, and I have some questions about senior care. So the first question I have is, can you just tell us a little about yourself and your role as an assemblywoman for the 87th district in the Bronx?
Sure. I'm very happy to be here with you, Teresa. So I am Assemblymember Reyes. I represent the 87th Assembly District in the Bronx, which covers the areas of Parkchester, Castle Hill, West Farms, and Van Nest. In the Assembly, I am the lower chamber of the state government. So we have the State Assembly and the State Senate. I say that my job is in three parts. One, it is passing the state budget every year and bringing the voice of my community to that process to make sure that we are represented in how funds are allocated and our funding priorities for the state of New York. Two is I do constituent services, and I have a team in my office that takes care of that in the district right here in the 87th. I'm actually right on, next to the Parkchester Library on Westchester Avenue. And in that space, what we do is we get constituents that come in with issues about rent, about evictions, health insurance, schooling, whatever that we can to connect them to municipal services or state services, or facilitate perhaps filling out applications, because oftentimes a lot of services require filling out application, faxing documents, all of that. We help them do that in our office. And I think the third part of my job is running an election every other year and running for office, and making sure that members of my community are civically engaged, and paying attention to politics in our neighborhoods, and asking for their support and their votes so I can continue to serve them in the state assembly.
Thank you for that. So with that said, what are some projects or legislation that your office has created to make the quality of life for Bronxites better? And in particular, I want to focus in on seniors as well.
Okay, so I introduced a piece of legislation 2 years ago that makes automatic enrollment for SCREE. And that's one of the key issues that we help constituents with every day in our office is applying for SCREE. So SCREE is it's like a tax deduction that's given to the landlord, but it comes as a reduction in the rental increases, the yearly rental increases for seniors who meet a certain criteria, make below a certain amount in the household, have a fixed income, and we facilitate that process. But what I've realized is that oftentimes our seniors don't take advantage of it. They don't know it exists. And for me, I think it was important to just make that automatically and automatically enroll seniors in it without them having to do the work. Because oftentimes the paperwork and understanding that the program exists creates a barrier to this service. So that's one of the main issues that I've been happy to champion in the Assembly. Along with other pieces of legislation, I have over 40 pieces of legislation that I've sponsored and authored myself, and have co-sponsored over 300 pieces of legislation that help our seniors in the state.
Thank you for that. So one of the reasons we did want to speak to you is because not only are you an assemblywoman, but we know that you are also a double threat. You're a nurse You threw yourself right back into that role to answer the call for help during the height of COVID, and we thank you for that. We all know that COVID has ravaged the senior community and cut off their access to basic needs in life. So, what are some of the resources here in the Bronx that can help seniors gain access to basic needs like food, medical care, or even technology?
Good question. So during the pandemic, one thing that we've done is facilitated the application process for SNAP benefits. For those folks that need food stamps, that have found it difficult to be able to afford food during this time. But we've also partnered with many organizations throughout the city to bring food pantries and food delivery right here in our borough and in our district. We've held multiple food distribution events. And particularly when I do food distribution events, I like to do fresh produce and grains, because I know that the healthier options are better, but also because we have folks with different cultural needs who prepare food differently. And for our seniors, particularly who were forced to stay home, cooking was an activity that kept them engaged, it kept them busy, and it kept them active. So it was more important for me to make sure that they had the provisions they needed so they can prepare their own healthy meals and not just bring them cooked meals. But for those folks who can't prepare their own meals, we were also doing food distributions through World Central Kitchen and bringing prepared meals that they can have for breakfast, lunch, and dinner. But one of the things that we also did, because it's not just about food access during this time, medical access has been important. And very early on in the pandemic, we were advocating to make sure that testing was free and that testing was accessible for everyone. And that we expanded testing so folks were able to get it right here in our communities. And now with the vaccine rollout as well, we made sure that the city and the state were bringing the vaccines to people where they were. And that meant opening up vaccine sites in our communities, facilitating the appointment process. We were actually helping folks with the appointment process because we know a lot of our seniors couldn't navigate the online appointment portal. It was difficult for people who were tech savvy, even more so for our seniors who may not be as literate and as fluid in terms of technology. So we've been making sure that our vaccines are free and they're accessible. And now we're at the point where you no longer need an appointment. You can walk right in and get the vaccine. We've been working to disseminate information and dispel some of the myths around vaccines and some of the hesitancy that I know our constituents have. They have a lot of questions about whether vaccines are safe. Has there been enough testing? What does it mean with all their other comorbidities and all the other conditions that they're juggling and dealing with, what the vaccine means and if they can do that safely along with all their medications. Some of them are immunocompromised because of medical conditions or medications that they're taking. So we've been helping not just craft those policies with the city and the state, but also helping disseminate them. And another issue that has been problematic during this time has been the issue of affording housing, rent. I was the original co-author of the eviction moratorium. But for me, the eviction moratorium had to be multi-pronged. It wasn't just that you couldn't put people out during this time, but also that we created a system where we could help landlords and small landlords, because I know many of our seniors have invested in a home and they rely on the income of their renters to pay their taxes or to pay their utility bills or to have that extra money to survive. So for us, it was important to create a fund in the state where landlords would be able to access that for those renters who haven't been paying their rent and get reimbursed. So we were able to pass that just recently in the state budget where we created a rental assistance fund. It's going to be managed through the Office of Temporary Disability Assistance. So that office is in the process of creating the program. And at the end of May, people will be able to apply to get rental assistance for up to a year and 3 months prospectively. So for those landlords or those seniors or those individuals that have found themselves unable to pay rent, we have money in the state budget currently to cover up to a year's rent plus 3 months. So I say to people, make sure you're paying attention, because very soon we're going to start sending information out so people can apply for that program.
That is surely good news. So thank you for that. So last year, the New York State Committee on Aging received testimony on COVID-19's impact on residential healthcare facilities and other long-term care settings, as well as recommendations for improving systems, protocols, and practices to reduce transmission and mortality rates of contagious diseases. Have the conditions improved for seniors who are in residential healthcare facilities? And if so, what are some changes that have been made to make those improvements?
I think conditions have improved because, and I like to remind people that at the beginning of this pandemic, we had very little information as to the spread of this, how people would fare. And what we started to see very early on was that our seniors, particularly those living in congregate settings like nursing homes, were dying at an astronomical rate from this disease. But because we didn't have the information or the science to back it, we were kind of flying blindly. And the guidelines and the guidance from the CDC was not changing just by the day. It was literally changing by the hour. And we were trying to readjust as we went on. And I say this as an elected official, but I also say this as a nurse who was working on the ground and having to implement those changes in real time. So a lot of the things that we saw were based out of fear because we didn't know what was happening, right? There were people who worked in nursing homes who were afraid to go into work. Very early on, we weren't testing as readily our staff, because I am a firm believer that COVID got into our nursing homes, not because of the residents there, but because of the staff, because the staff were the ones that were coming and going on public transportation, multiple shifts a day. Many of them work multiple jobs, which means that they oftentimes work either in a hospital setting and then also in a nursing home setting. And the virus was coming with them. We didn't know that there was asymptomatic spread. So because we didn't have all that information, it was difficult to mitigate that. And I think patient care suffered because of that fear, right? People were getting sick, so you had less staff to care for folks, less staff to be able to sit people up and feed them, less staff to do the daily activities of daily living, to help them shower, to help them groom, to change them, to turn them. So because we had the workforce suffered, the care suffered. And I think we're at a place now where we have a better understanding and a better handle on how to prevent the spread. But more so, we had a reckoning in our government. And we, people like myself who come from the medical field, have been saying this for years, that we needed to change the way we deliver care in long-term settings in our state. And because of everything that's happened, because of the hearings that we've had, because of the amount of deaths, and because of the public outcry, we passed a package of bills that changed the way nursing homes function in our state. One of them is being we are mandating nurse-to-patient ratios in long-term care settings. So you no longer are trying to stretch one nurse thin to care for a significant number of patients. So that is now the law and in statute. We changed we passed a law to mandate how nursing homes spend their money. Oftentimes their state revenue and their healthcare dollars that they get from charging the patients for being there. And we said that a majority of their revenue has to be spent on actual patient care, not to be used on exorbitant executive salaries or things that had absolutely nothing to do with patient care or did not impact patient care. We also passed laws to mitigate the opening of nursing homes from agencies that were bad actors. Many of our nursing homes are private providers, and they use a rating system that isn't realistic. But there was no way to control if you had a poor rating, that you were able to continue to open up facilities, nursing home facilities, without anybody saying, wait, if you're not doing well with one, how can you do well with five? So we passed a law to limit that and mitigate that as well, that you need to be a good provider and a good actor in this space if you wish to expand. And many other issues. And now, as legislators, it's our job to continue to be watchful and make sure that the laws that we've passed are being implemented how we intended them to, and that they're having a positive impact on the lives of those folks and our residents who live in long-term care facilities.
Wow, those are such important things that you've pinpointed, and I'm glad to hear that they can no longer buy a $2,000 chair with money that should be spent on caring for the seniors. Right. We know that especially in the Bronx, a lot of our healthcare facilities for seniors are understaffed, and the seniors are the ones that suffer because of it. So thank you for that. So I just want to know, do you have any final words that you'd like to share with us this afternoon about senior care?
Well, I'd like to say that as somebody who is a caregiver and somebody who works in the medical field, you know, I want our seniors to know that we're paying attention. And oftentimes it takes some time to make change, but we have been fighting for this and will continue to fight for this, to make sure that our seniors are living with dignity and treated with dignity, because we wouldn't be here without them. And I think it's important to have people in leadership who value their lives and value their well-being. And I think that at the end of their lives, these should be their golden years, right? They shouldn't have to worry about putting food on the table or deciding whether they pay their rent or buy their medications. They should be able to go outside and feel safe, and have everything they need. And if they need help, be able to receive it. And that's going to take us changing many systems. And unfortunately, it's going to take some time. But I want to reassure them that there are people in leadership who are paying attention and who care about these issues. And we have a vision for what we want to see. We want to see what the lives of our seniors can be and should be in our city and in our great borough of the Bronx.
Thank you for that. Our seniors certainly deserve a good quality of life after they've worked so hard. So thank you for that. And thank you for fighting for our seniors. So thank you for listening to our session on senior care with our Assemblywoman Karines Reyes.
Thank you, Teresa.